Well, fall is generally the start of flu season, so getting ahead of it could help you avoid illness. Chandan Sangha, Pharmacy Zone Manager at London Drugs, is here with some preventative advice. Good morning.
Good morning, Corey.
So why don't we start off with the flu shot? When is the best time to get it?
Yeah, great question for sure. So the ideal time is definitely early in the flu season, typically around late October to early mid-November. The public flu or influenza campaign this year begins October 20th in Alberta. So immunity does take about 10 to 14 days to actually develop. So getting vaccinated before peak flu activity gives you the best potential for protection. So Alberta residents aged 5 and over are eligible for the public flu vaccine at pharmacies. Most pharmacies will prefer appointments for sure, but we'll also likely be accepting walk-ins. So just check with your personal pharmacy to confirm what works best for them to get you in the fastest.
And the next one, there may be some confusion around it, but what about COVID vaccines? Can we get them at pharmacies this year?
Yeah, it's definitely a little bit different this year compared to previous. So public or COVID vaccines at no charge for Alberta residents will only be available at Alberta Health Services public health centers this year. You can visit their website, www.alberta.ca/COVID, or call HealthLink 811 to determine eligibility or book an appointment for that. Pharmacies will still have some private pay COVID vaccines available, and some private insurance plans actually may help cover some of the cost, if not all of it. So I'd recommend checking with your insurance provider or your pharmacist for more information for your specific case for sure.
Good to know. Now, is it okay to get a vaccine when we're feeling maybe a little bit sick or we have allergies?
If you have, moderate or severe illness like a sore throat or fever, it's probably best to wait a little bit, at least until you're feeling better. In terms of allergies, most allergies, including egg allergies, don't actually prevent you from getting the flu shot. You can check with your doctor or your pharmacist giving you your vaccine if other allergies you have may be of concern. But yeah, I know a lot of people worry about, I'm allergic to eggs because a lot of flu shots and stuff they actually manufacture using eggs. It's not a concern.
Okay, and when should we see a doctor if we're feeling sick instead of just treating flu or COVID symptoms at home?
Yeah, so many respiratory infections, I'd say, last for about 7 to 10 days and standardly clear up on their own. I'd recommend seeing your doctor if you have symptoms that are a little bit more severe, so things that are lasting more than 10 days or worsening over time. If you have any trouble breathing, chest pain, or high fevers that just won't break, you should probably seek medical attention. Seniors, young children, and people with chronic conditions are definitely more at risk, so you want to be extra cautious with them. If you have more moderate symptoms, you should probably just stay home from school or work and get some rest, just so you're not making other people around you sick as well. You can talk to your pharmacist about medications that could help ease those symptoms in the meantime for sure. But yeah, you just want to take those extra precautions around this time of year.
For sure. And do you have any other reminders to stay healthy this fall and winter?
Yeah, I think a lot of it, again, is stuff that we've heard over and over the past several years. So making sure, to prevent your risk of respiratory infections, you're getting your vaccines, plus, washing your hands, hand sanitizing if you're going to be touching high touch point objects, things like doorknobs, handrails, that kind of thing. But practicing social distancing is always a good idea, trying to keep 3 meters away or avoiding your exposure in high crowded spaces. And then some of this stuff, again, is basic, but quite often gets overlooked. So, making sure you're getting lots of sleep. And then even though we are coming into the holiday season and there's going to be a lot of food coming around, making sure you're trying to eat as healthy as possible and making sure that you can get some exercise where possible as well, just to try to help maintain your health where you can.
Perfect. Chandan, thank you so much for this information and advice this morning.
Thanks, Corey.
For more pharmacy information, visit londondrugs.com. And as a reminder, please talk to your healthcare provider before making any healthcare decisions or for guidance about a specific medical condition.